Good morning, everyone, and welcome. Thank you so much for streaming to spend your Sunday morning on this virtual American Lung Association in Alaska breakfast. We're so pleased to have you here. We hope to inspire you with the mission of saving lives by improving lung health and preventing lung disease. I'm Maria Downey, and my day job, I am an anchor and the senior executive producer at Alaska's news source, which now is Channel 2 and Channel 5. I also consider it part of my job and my pleasure to volunteer at worthwhile, and in this case, life-saving events, ways to improve the life of those in our community and across our state. And the Lung Association helps to do just that and has been doing so now for more than 100 years. My interest stems from my own family's history with lung disease. My father, Pete, a tough Sicilian man, loving father, passed away after a very long and brave battle 7 years ago. And to my own diagnosis with sarcoidosis about 20 years ago. And thankfully, I have been in remission for 15 years now. So we're here for all the same goal, to help the Lung Association in its ongoing and decades-long fight against lung disease. We'll begin by recognizing the corporate sponsors who have made today's event possible and helped throughout the year. Special thanks to presenting sponsor, Anchorage and Valley Radiation Therapy Centers, and thank you to all of the event sponsors, the Alaska Native Health Consortium, Alaska Federation of Filipino Americans, Alaska Regional Hospital, Matsu Health Foundation, Northwest Strategies, Hewitt Communications, and welcome especially to our new partners, Coniag, MEA, and SLR International. Thank you also to our VIP breakfast basket sponsors, Cars Safeway and Anchorage and Valley Radiation Therapy Centers. Thank you so much for your support. Breathing is the most important thing we do each day. In fact, humans can survive 5 weeks without food, 3 days without water, but only 3 minutes without air. And yet, often many of us take it for granted every day. Did you know your lungs are your only internal organs that are constantly exposed to external environmental issues? We take an average of 15 breaths a minute, which adds up to 21,000 breaths a day, which is 6 million breaths per year. For more than 34 million Americans who live with lung disease, breathing is not taken for granted at all. The same is now true for the millions of Americans sickened by COVID-19. 220 marks the 50th anniversary of the Clean Air Act, a landmark public health law enacted with bipartisan cooperation that has saved hundreds of thousands of lives. 50 years ago, the nation was split on the war in Vietnam, on women's rights, civil rights, and more. But during the 91st Congress, the US Senate even rejected 2 Supreme Court nominees, yet even against the backdrop of a sharply divided nation, Congress, Republicans, and Democrats came together to pass the most powerful, important, and far-reaching public health law in history, the Clean Air Act. The legislation was hard fought, but ultimately the law passed the Senate 73-0 and the House 375-1. Unbreathable, the fight for the healthy air premieres at a critical time. Over the past 50 years, there has been major progress in reducing air pollution all across this nation, thanks to the Clean Air Act. However, nearly half of all Americans across the country today are still impacted by unhealthy levels of air pollution. At the same time, emerging research links air pollution to higher death rates from COVID-19. The 30-minute film you're about to see shares the success of the Clean Air Act, inspiring stories of American communities that are still fighting for healthier air and the challenges the Lung Association faces to ensure healthy air for all people. Directed by award-winning filmmaker Maggie Burnett Stockner, Unbreathable is sponsored by American University Center for Environmental Filmmaking in partnership with the American Lung Association. Please enjoy the Alaska premiere of Unbreathable, The Fight for Healthy Air, and stay with us for our panel discussion and awards right afterwards. Excellent film, excellent message, and I loved what Sharon Richards and Julie and a few others mentioned about showing this to our young people in schools. What a wonderful, wonderful message for all of us to protect our planet. And thank you so much to the American Lung Association for helping to make this film possible. Thank you so much. Well, at this time, I'd like to introduce our panelists and then ask them some questions relating to the film and to clean air in general. Dr. John Clark is a pulmonologist at the Alaska Native Medical Center and currently serves on the American Lung Association in Alaska Leadership Board. Prior to his role at ANMC, Dr. Clark worked in private practice at Providence, where he served as medical director of respiratory therapy for nearly 20 years. He grew up in Dillingham and graduated from the University of Washington School of Medicine through the Alaska WWAMI program and completed his residency in internal medicine at the University of Washington. Dr. Afif El-Hassan is a pediatrician with Kaiser Permanente in Orange County, California. He has been an active member of Kaiser's asthma care management team for more than 13 years now. Dr. El-Hassan has been involved with the American Lung Association since 2000 and currently serves on the Pacific West Regional Board. He also volunteers at the Air Quality Management District on the Environmental Justice Advisory Group. Dr. El-Hassan received his bachelor's degree at UCLA and attended medical school at St. Louis University. Lisa Murkowski, Alaska's senior U.S. Senator, is a third-generation Alaskan proudly serving as the first Alaskan-born senator since 2002. Senator Murkowski was born in Ketchikan and raised in towns across the state, including Wrangell, Juneau, Fairbanks, and Anchorage. She is the chairman of the Senate Energy and Natural Resources Committee and also serves on the Senate Appropriations Committee, where she is the chairman of the Interior and Environmental Subcommittee. Senator Murkowski is a member of the Senate Health, Education, Labor, and Pensions Committee, the first Alaskan to serve on that panel, and also is a senior member of the Senate Indian Affairs Committee. Shalonda Michelle Nelson, sorry, Shalonda, grew up in Little Rock, Arkansas, and relocated as an adult to Fairbanks. Shalonda lived in Fairbanks from 2000 to 2015, when she had to leave due to personal health impacts as a result of breathing particle pollution. Shalonda volunteered and interned for American Lung Association in Fairbanks, and while she was there working to help pass the tobacco-free campus policy for all University of Alaska campuses and the Smoke-Free Alaska Law. Since she returned to Arkansas, Shalonda has become a cancer survivor, model, inspirational speaker, actress, student, and activist for equality and equity. We begin with Senator Murkowski's recorded remarks as she was unable to join us live today.
Hello, and thank you for the opportunity to speak with you today. My thanks to the American Lung Association for hosting this event, and to all of you for your efforts to help Alaskans breathe easy. One of the best parts about coming back home to Alaska after my work in Washington, D.C. is to breathe in the pure, crisp air. Alaska is well known for its pristine lands and waters, its clear skies and fresh air, which attract thousands of visitors to our state each year. But even with such pristine landscape, we face challenges to ensure that our air is clean and healthy. In Alaska, particulate matter and wildfires are the primary threats to our clean air. I know that it surprises many folks to learn that Alaska has some of the worst air quality in the United States at given times. Our use of wood stoves has increased the amount of soot and particulate matter that lingers in the air. This is especially found in the interior and in those communities with limited access to electricity or fuel. So to help address this, I introduced legislation that we called the Wood Heaters Emission Reduction Act. I did this back in 2019. This bipartisan legislation establishes a grant program at the EPA to support the removal and replacement of old, inefficient residential wood heaters with cleaner burning models in rural and tribal communities. Through my role as chair of the Interior and Environment Appropriations Subcommittee, I've also made sure that funding is provided each year to support programs like the EPA's Targeted Airshed Grant Program. This supports air quality improvement projects in Alaska, and the Diesel Emissions Reduction Act grant program. This helps Alaskans, including our fishermen, shift to cleaner burning engines. Like our friends in Oregon and California, Alaskans know firsthand the smoke that can be released from our wildfires. Last summer was particularly tough. During the Swan Lake fire, plumes of dense black smoke enveloped the Kenai Peninsula, closing the Sterling Highway and suspending flights for periods of time. Anchorage had its first ever dense smoke advisory issued by the National Weather Service, and smoke from the Kenai was tracked by NASA, traveling through Canada and extending as far east as the Great Lakes region. As part of the wide-ranging public lands package that I passed last March, we directed the Forest Service to assign air quality advisors to large wildfires. So these on-the-ground monitors will embed with fire camp commanders to more quickly notify state and local officials about the predicted direction as well as the density of wildfire smoke plumes. Forest Service has begun standing up this program, and several advisors were assigned to fires this year. Longer term, addressing the increased risk of wildland fires as the climate warms is going to be an important effort in Alaska. We also need to focus on supporting energy innovation to reduce our carbon emissions. I've got an energy bill, an energy innovation bill actually, which includes numerous provisions focused on clean energy, building efficiency, and improvements to the Weatherization Assistance Program. This is really a win-win on air quality, climate, and energy efficiency. We're working to pass this legislation. We're going to keep pushing on it, but we'd like to get it sooner than later. But again, thank you for the opportunity to join you as you celebrate the 50th anniversary of the Clean Air Act. We know that we've got more work to do in Alaska, but I'm heartened to see that this group of dedicated advocates that I count on as partners is doing such great work. So thank you and take care.
Thank you, Senator. And we will hear next from Dr. Al Hassan. Doctor, the COVID-19 pandemic has highlighted the importance, of course, of lung health. Air pollution triggers asthma attacks, wheezing, heart attacks, stroke, and can also cause lung cancer, dementia, and premature death. Now emerging evidence suggests that those with long-term exposure and even small amounts of air pollution are more likely to die from COVID-19. Because of this pandemic, do you think Americans are more aware of air pollution and health equity?
Yes, I actually, that is one of the things that I've been very happy to see, is that people are actually trying to take control of their health and trying to protect themselves in every way that they can. And an understanding of the air quality and what it's doing to people has been extremely important. We have, our lungs obviously have defenses, our nose, the back of our throat. There are natural defenses that we have against illness. And when those defenses are compromised by air pollution, which damages the cilia, the little hair-like structures in our noses, in our upper air passages, when it causes increased secretions and irritation, our body's ability to fight back against infection, to push out infection, to filter out infection, to bring the body's defenses to an area where there is an infection becomes compromised. So air pollution is a huge factor, and we're realizing that more and more with COVID-19. And this is now going to translate back, I hope, once we defeat COVID-19, and I hope we do, it's going to be an understanding in general. All illnesses, all viruses, the flu, whooping cough, whatever you can think of, any virus or any illness that the body is trying to fight is going to be get an edge on us if our defenses are not in place, and if we are in areas of high air pollution which compromise our defenses, we are going to be vulnerable to all kinds of illnesses. So I do think there's education there. It's one more compelling reason why we do have to fight for air that's clean and without pollution. So I'm hoping people remember that when COVID is defeated, and I hope it is soon. I'm going to be optimistic about that. But people understand now, and people are trying to educate themselves on the medicine behind everything, on our own anatomy. So hopefully moving forward, like I said, one more reason we have to fight for clean air.
Thank you so much for that insight, Dr. El Hassan. So important. You know, we've all heard about the horrific wildfires in California, the Pacific Northwest this year. Alaska luckily was spared this summer, but in 2019, there was over 700 fires that burned over 2.5 million acres statewide. Every region of our state was impacted by a wildfire and smoke. Dr. Clark, can you give us some insight, a few comments on the effects of wildfires on respiratory systems?
Yeah, the population effects of wildfires are not completely understood. And so I'm going to comment on things that we do know. And we know that wildfires are an ancient and vital part of the Earth's ecosystem, and that their frequency, intensity, and magnitude have increased in recent years. It's probable this increase is a result of several convergent factors: population growth, urban sprawl, ineffectual, inconsistent, and politicized forest management policies, human carelessness, and of course, climate change with longer, drier, and hotter summers. And in contrast to other natural disasters, we know that wildfires are prolonged events, that they can follow an unpredictable course, and that the smoke can adversely affect the health of people over very large geographic areas. We know that as many as 20% of the population has some form of airways disease, irritable airways or asthma, and these folks are especially sensitive to the adverse effects of wildfire smoke. In the short term, we know that exposure to wildfire smoke results in increased symptoms of cough, shortness of breath, ER visits, need to escalate treatment of underlying conditions such as asthma. In the long term, there's really quite substantial evidence that exposure to fine particulate matter may increase the risk of developing asthma or small airways disease or bronchiolitis. And in addition, those small particles that they refer to as PM 2.5 may enter the bloodstream and be associated with increased risk of vascular disease, including stroke and cardiovascular disease. There is also evidence that elevated levels of PM2 may be associated with adverse birth outcomes in pregnant women. And in addition to the direct adverse health effects, wildfires adversely affect health by creating social and financial stress, displacing people from their homes, and especially in the age of COVID, exposing them to increased infection risk in evacuation shelters. The inability to get outside for walks or engage in gardening or yard work or social gatherings over time also has significant negative psychological as well as physical health effects. During the hunkering down period of COVID-19, for instance, many people, patients of mine included, commented on the quote, COVID-15, referring to the 15 pounds they'd gained as a result of the pandemic. The comedian Bill Maher lamented that in times past, the plague had a quote, slimming effect, but not now. The effect of wildfires on health it's a big topic, and we could spend days or a weekend or a week discussing it. But I'd like to share a few thoughts that kind of represent some personal views, and they don't represent any official position of the ALA or anyone but myself. But when it comes to big topics like global warming, wildfires, and pandemics, there's two main approaches that we can take. And one is to mitigate, and the other is to adapt. And I think these aren't mutually exclusive choices. We have to do both. As a state and a country and a global community, there's many things we can do to mitigate environmental risks. But often these require difficult personal and political changes by thousands of people, sustained over time. interventions to slow global warming or reduce wildfire risk or control pandemics also have enormous financial implications, which makes them politically very difficult. Despite these challenges, we really have no choice but to address these issues head on. And frankly, this is one of the reasons why I support the ALA, because they're really a vital part of accomplishing this. I think we saw that in the excellent movie we watched this morning. But we might as well be honest and admit that needed changes to mitigate risk might take years or even decades to accomplish. Again, back to the movie we watched this morning, President Nixon in 1972, founded the EPA, and we're still battling some of these challenges. So we have to also learn how to adapt to challenges such as global warming and wildfires and pandemics. And to me, the underappreciated power of adaptation is that each of us can affect meaningful change right now with minimal or modest investment in time and money. We hear appropriately every day about the more than 200,000 Americans who have died of COVID infection so far. And this is indeed a tragedy. But we don't hear often enough about the more than 700,000 Americans that die prematurely each year as a consequence of tobacco use, obesity, and sedentary lifestyle. And there's 3 simple individual health behaviors: not smoking, exercising 30 minutes a day, and maintaining a healthy weight that could save hundreds of thousands of lives a year. We also know that in terms of wildfires and pandemics, that active, fit, healthy individuals fare much better if they do get infected or exposed. So it seems obvious to me that we have to both mitigate and adapt. And it's also obvious to me that the best time to do so was 20 years ago, but the next best time is right now. So Pogo famously said, we've met the enemy and he is us. But he also said something that I think is much more important and less commonly quoted, which is, we're confronted with insurmountable opportunities. I think the ALA provides vital input to our collective political and national efforts to promote policies that will mitigate the burden of adverse health effects of climate change, wildfires, and respiratory infections, including COVID, tuberculosis, and others. At the same time, the ALA also supports many fantastic individual health initiatives related to smoking cessation, supporting creation of parks and safe places for exercise and recreation, and supporting medical efforts to improve lung health, all of which have an enormous effect on our ability to adapt to an ever-changing environment. And so I really don't think there's ever been a more important time in our history for us to support the ALA, which is why I'm here this morning instead of watching the Seahawks game.
Thank you. So well said. Thank you, Dr. Clark. Thank you so much for your input. Fairbanks air quality, by the way, has failed to meet the national air quality standard for particle pollution for several years and currently ranks number 4 for the most polluted metro area nationwide for short-term particle pollution. It's hard to believe. The Fairbanks North Star Bow is in a serious non-attainment for particle pollution with the Clean Air Act. The pollution source is primarily residential wood burning for home heating. And this last year, with the Lung Association support, a new proposed plan to bring their air into attainment by 2029 was submitted to the EPA. So, Shalonda, would you please share your story of breathing Fairbanks air and how it impacted you and your life?
Yes, and I'll point out that my voice is very raspy, which is due to the exposure of years of wood smoke there in Fairbanks, Alaska. That I ended up with cancer, stage 4 cancer, transglottic laryngeal cancer. I'm a mother of 4, and I started working at a local school there at Wood River Elementary, where my children they were currently students there. My kindergarten daughter would not go to class unless I stayed in the hallways next to the door of her classroom. So she came up with this bright idea. She says, "Mom, just go ask the principal for a job here." So that's what I did. And I ended up working as a reading tutor. Only a few months into that, I started having symptoms of extremely painful headaches. They were so bad, I had to tiptoe through the hallways to pick up students for reading. I started having extreme fatigue, asthmatic symptoms. I couldn't breathe hardly between words. We had the video. Man, that video really evokes some emotions, and I had to turn my camera off so that I could cry a little bit. I recall days of citizens standing outside with signs saying the air is not safe here. I'm a girl from Arkansas. I did not understand that. I told my kids to run into school, to not talk to the people with the signs. But little did I know that they were trying to give us a message. And that message became also real to me. When I was outside on the playground with the students, we had several small days and the children could not go outside to play. However, the principal this day sent them out anyway. Our school was inundated with smoke from the neighbors on top of the pollution throughout the borough anyhow. The neighbors burned a lot of wet wood, so that they could heat the duplexes across the street from the school and save money on fuel. Well, this smoke inundated the hallways and playgrounds of our school. And on that particular day, it was really, really bad. I recall my throat starting to feel very coated, my chest hurting, and I started having difficulty breathing. Didn't know what was going on because otherwise I was really healthy, playing football, basketball, hiking with my kids and the neighborhood children. However, I had to leave school early. I got home, I sat down, and I just kept dozing off, and I couldn't hardly walk without having a breathing attack. I called my doctor. They listened to my voicemail and said, "You should have went to the ER." I never got sick, so I didn't know that. And the long story short, by that weekend, I did end up in urgent care, and from urgent care in an ambulance and to Fairbank Memorial Hospital. I had suffered a PE to my lungs. They started calling me the miracle lady because there was no way I should have lived from Thursday to Sunday with a PE in my lungs. That was just the beginning. That went on for years with health issues, one after the other. I was about 31 years old when it started. I developed a growth in my lungs that blocked airways. Had to travel from Seattle to Colorado to Anchorage, back to Fairbanks for years. This took a toll on our family and our finances, and unfortunately, it was not something that my children's father, whom I was married to for about 16 years, 15 or 16 years at that time, he did not want to undertake. And so we ended up splitting. I moved to Arkansas, still searching to find out what was wrong with me. I ended up at a hospital called UAMS, the University of Arkansas Medical Sciences. And within months, they found that I was right at stage 4 cancer. I was living in the back room of family homes. I was a single mom now and working several little part-time jobs. Some I was doing freight in the back. Some I was tutoring students after school in a low-income area. And then I ended up catering and taking the food from the catering lines home to feed my family. I didn't realize how serious my life would undertake from these medical issues that I received from breathing in the air in Fairbanks. As stated earlier, we breathe, 21,000 breaths a day. So imagine that in every breath, I'm taking in particulate matter of 2.5 micrometers or smaller. Imagine what it's doing to my lungs, my throat, my blood. So I continued to fight, and I went through 33 treatments of radiation to my head and neck area, which again is why my voice is so raspy to this day. Some days I don't always have a voice. So I took that fight and that battle. I went through hospice. The doctors gave me up to 6 months to live. They equated me to a person that had smoked over 20 years, and I never smoked a cigarette a day in my life. In fact, I fought for smoke-free workplaces and campuses. That was my life. And so now I'm here with this illness. I'm making less than $15,000, sometimes $11,000 a year, raising children by myself with a health issue. So when I hear individuals talk about how pollution impact our lives, health, financial, even your spiritual life, because you're so sick that sometimes you're not even sure you want to continue to live. So every day becomes a battle for you. Sometimes your children is enough for you to keep fighting, and sometimes they're not. And that's the reality. And so I was very grateful that American Lung Association allowed me, when I lived in Fairbanks, to be an intern. They were so encouraging, and they gave me a platform to continue my fight outside of clean air advocacy. And I will forever be grateful for the work that American Lung Association does. Just the fact that someone can take the time and advocate for something that we should all have a right to breathe, which is clean air. But we can take it for granted, and others may not see the importance of it. So our voice here today means so much. So thank you so much for having me, and I appreciate you for listening to my story.
Wow. Thank you so much, Shalonda, for sharing your very personal journey with us today. We're so grateful that you were here. My name is Sabrina Combs. I'm an American Lung Association and Alaska board member and a lifelong asthmatic. I first got involved with the Lung Association at the age of 7 when my parents discovered Champ Camp, which was a summer camp for kids with asthma. It was the first place where I felt really great about playing outdoors and just being a kid, because I was safe and surrounded by kids who also had to sometimes stop in the middle of a game of tag or swimming in the lake to use their inhaler. It was an embarrassing issue that I worked carefully to minimize around my non-asthmatic friends at home. I learned a lot from the camp counselors and nurses and doctors about how to control my asthma and be prepared for asthma attacks. And at the age of 8, I was selected to be the Lung Association's Christmas Seal poster child, where I got to travel around South Central Alaska and talk about lung health alongside American Lung Association leaders. I returned to Champ Camp year after year, making lifelong friends, and as a teenager, became a peer helper there myself, helping educate younger children about their lungs. The American Lung Association was there for me as a kid, and now I proudly invest my time and talents in them. Whether your passion for lung health is because you have asthma like I do, or you've lost someone to lung disease, or whether you want to just protect all of our lungs with clean, healthy air, you can help support the vital work of the American Lung Association in research, education, and advocacy with your donation today. It's now my honor to give all of you a chance to deepen your commitment to the work of the American Lung Association in Alaska. Many of us joined today with a specific dollar amount in mind to donate, and some of you gave when you registered for the breakfast. However, some of you may be in a position to do more and could join us in one of our giving circles. Our Champions of Breath Circle honors donors with annual giving at 3 leadership levels. You can join our Champion of Breath Friends level with a gift of $500, or perhaps you're in a position to be able to join at the partner level of $1,000, which is $83 a month for a year. Or you may be able to become a Guardian level Champion of Breath by giving $250 a month for 10 months, $2,500. Our Giving Circle members help lead our mission by building upon the association's landmark victories, including ending the tuberculosis epidemic, passing and strengthening the Clean Air Act, passing the Tobacco Control Act, eliminating smoking on domestic air flights, advancing lung disease research, helping to make lung cancer screening possible, passing the Smoke-Free Alaska Law, and launching the COVID-19 Action Initiative to end COVID-19 and defend against future respiratory pandemics. Regardless of the amount that you're able to give, we hope we've inspired you today to help make a difference through the work of the American Lung Association in Alaska. When we began our program this morning, thanks to our corporate sponsors and those of you who donated up front, we had raised $31,000 towards our goal of $35,000. It's now my honor to humbly ask you to consider giving what you can now. You can give online at breatheeasybreakfast.com. You can use the pledge card in your VIP basket and mail it in, or you can text to give immediately by texting AK Lung to 243725. I'm going to take a minute now to pick up my phone and make my own donation, and I will invite you to do the same. All right. Thank you so much for supporting the American Lung Association in Alaska. You have all made a huge difference today. I'm now going to turn it over to our Executive Director, Marge Stoneking.
Thank you, Sabrina, for your leadership and your giving. Before we get to our awards, I'd like to invite you all to do one more thing. I invite you to raise your voice to protect health from air pollution and climate change with the American Lung Association. Register to stand up for clean air at lung.org/air, and we'll send you tips on how you can make a difference on healthy air and climate change. I'd like to thank our Breathe Easy Breakfast Committee for leading the way on this first virtual breakfast. And I'd like to recognize and thank all of our American Lung Association in Alaska board members for all they do to guide and support our mission of saving lives by improving lung health and preventing lung disease in Alaska. And all good things must come to an end. So today, I'd like to honor and thank two outgoing, longtime board members for their significant leadership and service. Julie Haskett is a lung force hero, having publicly shared her story as her mom's lung cancer caregiver to raise awareness of lung cancer. Julie has served as a local board member for the Lung Association here in Alaska for 13 years, a regional board member twice, and she is finishing her second term as our Alaska chair this year. Julie leaves a legacy in her mother's honor of successfully advocating at the local, state, and federal level. She testified and traveled to Juneau multiple times over 6 years to help get the Smoke-Free Alaska law passed to protect Alaskans statewide from secondhand smoke in indoor workplaces and public places. And she traveled to Washington, D.C. to advocate for adequate, affordable, accessible health care. Julie, you leave big shoes to fill, and we are deeply grateful for your leadership and service, and we thank you. And we don't have time for all of our honorees to make remarks, but with a legacy of service like that, we want to give that honor to our outgoing chair. So Julie, would you like to make a few brief comments?
Thanks, Marge. If you know me, you know, of course I do. And also, I always get emotional at this dark breakfast. But I just want to say that the great thing about the Lung Association service is you get to actually see your impact. And we did pass smoke-free workplaces. We did pass tobacco 21, no on-site consumption of marijuana. And so it has been so rewarding. And although I'm going off the board, you know, I'll be around. And thank you so much. Tomorrow night always fall apart here. So thank you so much. I won't be far. I will always support this organization, which I love so much. So thank you.
Thank you, Julie. Dara Glass joined our board in 2014, a year after losing her husband, Sam, to lung cancer. As a lung cancer caregiver, Dara too is a lung force hero, and in addition to supporting the passage of Smoke-Free Alaska, her legacy of service includes supporting the Lung Force Initiative and advocating to our federal delegation to ultimately raise federal lung cancer research funds by 101% between 2012 and 2019, which will improve lung cancer outcomes and save lives. Thank you, Dara. Dara's legacy also includes raising significant funds for American Lung Association since the time of Sam's diagnosis, when she began riding in the Clean Air Challenge bike trek. The Denali Award is given to recognize the monumental efforts of a business or individual who has raised over $50,000 personally in the course of their years volunteering with American Lung Association in Alaska. This year, we are honored to recognize two individuals as recipients of the Denali Award. And by sharing their commitment and personal stories to fundraise for the Clean Air Challenge bike trek over many years, these volunteers have done the work, made the asks, and have made a significant impact on our success in Alaska. Dara Glass is one of those award recipients, and Sherry Price is the other. So Dara and Sherry, we thank you for your work and recognize you with the Denali Award. Congratulations, and thank you both. Cheers to you.
Thank you all.
The Clean Air Challenge is our longest running fundraiser in Alaska and the longest running bike trek hosted by the Lung Association nationwide. It's a bucket list ride for trekkers who come from all over the state to ride in the shadow of Denali and sometimes in rough spring weather. Our volunteers are key to the success of the ride, and we have been successful in raising over $5.5 million since it began in the 80s. We began a new tradition last year to recognize one individual who does more in a given year to engage the community to make a significant impact on our success with the Clean Air Challenge MVP Award. So in recognition of the generosity of time, talent, and resources given, it's our honor to recognize an outstanding contributor to the 2020 virtual Clean Air Challenge. As such, it's my pleasure to name Sherry Price as our 2020 Clean Air Challenge MVP. Sherry's one of our longest continually riding trekkers, and she's participated for 17 years. When she began, she did so as an asthmatic and for fitness as an Anchorage police officer. 10 years ago, her commitment deepened when she lost her dad to lung disease, and then again when her mom passed on from COPD 7 years ago. I don't think there's anyone in Sherry's family or friend circle who hasn't been involved in the Clean Air Challenge as a rider, volunteer, or donor. She's for many years captained the team, pedal to the metal, and this year was no different when they hosted their taco feed fundraising party at her winter home community of Yuma, Arizona. In fact, they had a record-setting year, and that set Sherry up to become our 2020 top individual fundraiser. But her leadership and enthusiasm didn't stop there. When she arrived back in Alaska in early spring after quarantining, she put her pedals to the pavement to embrace the virtual Clean Air Challenge. She joined our Strava ride tracking club, where she logged over 700 miles over the summer and rallied her teammates to do the same. And on the last day of the virtual event, our finale, Sherry organized a COVID-safe ride, riding 100 miles with a handful of her closest teammates, after which they zoomed in to join our live finale celebration on Zoom. So for resilient and tenacious enthusiasm, leadership, and fundraising through our first virtual cycling event, and on behalf of the Clean Air Challenge Ambassador team, it's my privilege to present the Clean Air Challenge 2020 MVP Award to Sherry Price. Thank you and congratulations, dear Sherry. Here's to you. And now I'd like to bring back Dr. John Clark, our newest board member, to present our signature award. John?
On behalf of our board, it's my privilege to present the 2020 Breathe Easy Champion Award. This award is given to one individual or organization each year who demonstrates the following attributes: significant efforts to improve the health and lives of people in Alaska, a strong commitment to community, innovative thinking, compassion to those most in need, and alignment to the mission of the American Lung Association. I have some prepared remarks to share on behalf of the Lung Association board, but first I wanted to share a personal comment. As a practicing physician for more than 30 years, I've become the older person I didn't exactly see coming. And over the course of my career, I've been involved with numerous hospital committees, professional organizations, and community organizations. And I've observed that when faced with big challenges, physicians must make a choice, step up or step aside. And I frankly don't think there's any shame in stepping aside. Sometimes personal or family or professional obligations are such that we cannot step up. Those individuals, however, who are willing and able to step up, make a choice too. It's a choice that often means less personal time, less leisure time, less family time, and less sleep. I believe they do so to fulfill a basic calling we all share, which is to somehow make a difference. Dr. Zink, I want to personally thank you for stepping up and for helping all of us meet the enormous challenge of the COVID-19 pandemic and for truly making a difference. And now I'd like to share a few additional remarks about Dr. Zink on behalf of the Lung Association board. Dr. Zink grew up in Colorado and moved through her training from college in Philadelphia to medical school at Stanford University and then residency at the University of Utah. As a mountaineering guide, she fell in love with Alaska, and after completing her residency in emergency medicine, we were fortunate that she chose to make Alaska her home. Dr. Zink became involved in working to improve systems of care as the medical director of her group, then in her hospital, and in supporting state legislation to improve care coordination, opioid addiction treatment options, and integration between private systems in the VA, DOD, and IHS facilities. Dr. Zink became the state of Alaska Chief Medical Officer in July 2019. In all the work she does, Dr. Zink says she strives to create work environments, policies, and practices that are data-driven, foster collaboration, and build system efficiencies that put patients first. That experience and philosophy has prepared her to lead our state through the COVID-19 pandemic with compassion, humility, wisdom, and grace. Dr. Zink and her leadership of the state's response to COVID-19 has demonstrated all of the Breathe Easy champion attributes. She's made significant contributions to improving the health and lives of people in Alaska, demonstrated a strong commitment to community, innovative thinking, compassion to those most in need, and alignment to the mission of the American Lung Association. Dr. Zink, your leadership has impacted every Alaskan's lung health. We give you our heartfelt thanks for your strong commitment to making a difference in the health of Alaskans now and into the future. The American Lung Association in Alaska, on behalf of Alaskans, is proud to honor you as our 2020 Breathe Easy champion. In normal times, we'd now present you personally with an award, wild applause, and some handshakes. But with the current COVID-19 pandemic and recent snowstorm affecting deliveries, I have to tell you the award's in the mail. The 5.0 shake were delivered early Saturday morning. But on behalf of all of us, thank you again, Dr. Zink, for your work and leadership during this challenging time.
Wow, thank you so much, Dr. Clark, and to all of you in so many ways. You make me choke up there. You know, it is a calling, and the reason I am here is for Alaskans. I'll start with just a little personal story, but before I start that, I just really want to thank and congratulate the other winners of the award. To Dara, I have done the Clean Air Challenge, and it was actually what got me into road biking. So thanks for that, and have loved it since. And so even those small little things that seem small and are huge inspire a whole community, not only raise money for this community as well as for the Lung Association, but inspire people to be healthy and happy. And Sherry, for nice job getting out all those miles this year. That was a challenge. It wasn't the sunniest summer, and so that was pretty impressive. And Shalonda, thank you for sharing your story. You know, I think that it always comes back down to what is the patient and what's the patient story, and how is this about patients and not just about places or policymakers, and how can we bring it back to people? My journey into medicine actually, I think, began with my father. He was a really bad asthmatic in Minnesota and was so sick that he had to spend most of his summers indoors. And the doctors told him that if he didn't move out of Minnesota, that he would likely die and he probably wouldn't live until his 20s. He couldn't do anything outdoors, so he took up ice hockey because it was the one sport that he could do with better air quality. And when he was 9, they moved to Colorado. That was over 60 years ago, and we're still referred to as the family that left because they left a huge farming Minnesota community for his lung quality and for his ability to breathe. So they moved to Colorado Springs because of dry air and less mold, so he could be able to breathe. He played hockey. And he was recruited to the East Coast for college because he was a good hockey player and he happened to do well on a couple tests. He didn't think he would ever go to college. His mom was my grandmother was a waitress and his dad was a barber. And when he said he wanted to go to college, his dad told him that he was trying to be something that he wasn't, that he was a blue collar worker, and why would he try to prove something different to the family? But he felt like he needed to figure out more about why he couldn't breathe and what that looked like. So he ended up getting recruited to the University of Pennsylvania and became a graduate of the Wharton School of Economics, thinking that's what he wanted to do. But when he was in college, he got super sick again and was hospitalized for an extended period of time. And he realized that if he couldn't breathe, he couldn't do anything else. And so breath was fundamental to what he did. And as a result, he decided to go into medicine and became a hematologist and oncologist specializing in lung cancer, particularly with VA patients and patients who were underserved in other communities as a way to breathe. I grew up in that household where his drive for medicine was not a drive to have a job. It was a passion that is deeply embedded in who he is. Even with COVID today, he's still working at the VA hospital, even though he's almost 80, and we keep telling him it's probably not a good idea. But that is his love, and that's his passion. He invites me to the pulmonary ground rounds every week. And usually I just have him send me cliff notes because I don't get a chance to attend as often as I would like to. And he reviews all the literature and sends me weekly updates and asks me if I've read the latest and greatest on whatever is happening in the world of pulmonology. And I usually haven't, and I really appreciate his ability to keep there. But he also taught me early on that it was more than science, and it was more than a job, and it was a calling. And when I was a kid, I said I would never go into medicine because I wanted to bring cupcakes to my kids' class. And my parents were working a lot. And so my mom was an OBGYN and one of the first female physicians in medical school. I thought OB was really easy because it didn't work nearly as much as my dad. It wasn't until I had medical school that I realized that maybe that wasn't the case, and I probably underestimated my mom in a whole series of ways, but I think that's pretty typical for most teenagers in certain ways, and I've gained a whole new respect for their commitment and dedication. But they both really taught me that if I was going to choose a job, that it needed to be something I was passionate about, and it needed to not just be a job, but something I cared deeply about. I ended up doing a fellowship abroad, and I was looking at the impacts of culture and tourism on health and what that looked like. And I just found myself in clinic after clinic and found that I love that interface between people and science. And it was in that journey that I decided that despite my parents, I really actually did love medicine and the values they had taught me about the person, and being able to meld humanity and science was really where my heart belonged. And I could maybe make cupcakes at the same time for my kids' class. And so I decided to go into medicine, and it's been a journey. I thought a lot about surgery, but ultimately I decided to go into emergency medicine for two reasons. The first reason was because I got really excited that the pager would go off and I would get to be able to figure out what things were happening. You didn't get the diagnosis handed to you. You would get someone who says, my belly feels like wet sand, and you would figure out it was because they had a heart attack and they were in heart failure. You saw just the immense complexity of how people present in these just beautifully different ways. And I always felt like I got to sit on the front stage of all these amazing short stories of humanity. I'd pull back the curtain and someone would tell me their life story in 30 seconds and what was their scariest thing that was happening. And it's just this huge privilege to be front and center in what that looked like day after day after day. And I reveled in that just immense grace and that opportunity to be able to sit side by side with patients. I also realized that in a time of trauma, you have an opportunity to potentially affect change in ways that you couldn't before. We know that data shows that if you encourage people to stop smoking or to stop drinking in the emergency department, it's one of your most impactful times when they're coming in for other reasons. And so when you're able to tie a message of hope and change with a challenge someone's seeing, you get an opportunity to do that. I think one of my favorite patient encounters ever was a patient when I walked into her room. She looked at me and she said, "Not you again." And I was like, "Oh, tell me more." It's good to see you too. And she said, "The last time I saw you, you told me that the reason I couldn't breathe was because I was smoking, and it was making my lungs worse and it was making my asthma worse. And I went home and I committed to never smoking again. And that was 3.5 years ago. And it was the hardest thing I have ever done. And it was the best thing I've ever done, but you gave me really hard advice and it was challenging, but I am better. And now I'm here for back pain, and you're probably going to tell me it's because I'm obese and I need to start exercising more. And that's going to be really hard too. And I'm not sure I want to see you today." And I was like, "Well, you know, I am going to tell you that." And we sat down and we talked for a long time about having to have small habits and how you can make change slowly but surely. We talked about the, COVID-15 at the beginning, but there's also the other story of that. I have a friend who's lost 100 pounds since COVID started because he realized that obesity was a huge risk factor. I think that tells us two things. One, COVID's been going on a long time. And two, that it's never too late to change your actions and the ways to be able to take care of your health overall. And I want to just encourage people to continue to move that direction. I thought a lot about what I wanted to say at the Breathe Easy and this breakfast this morning. And there's nothing more fundamental than the breath. You know, in emergency medicine, you're trained to look at the ABCs: airway, breathing, circulation. And if you see it stuck on airway, you don't go to breathing. And if you go stuck at breathing, you don't go to circulation. That's what you're trained over and over and over again. That's how we approach every single patient. And be it a peanut stuck in the airway or swelling because of an infection, you have to stop there. And if you can't do that first, nothing else comes. Our life comes from breath and that very beginning fundamental part of who we are, all the way down. And you got to start there and then be able to work out. I think the other thing that's really taught me about breath is that prevention works. I think there was the video this morning talked about that, as well as Dr. McCormick. I remember growing up hearing about acid rain and thinking about the world just kind of collapsing around me and burning up. We don't talk about it in the same way. We've seen air become so much cleaner. And it's nice to think about all these like fancy ways that we can intervene later, but it's really in prevention that we're able to save the most lives. Thinking about clean water, clean air, and these fundamental things that we do to prevent. I oftentimes get, well, it's okay that, we've got hospital beds to treat. We've got these treatment options, and those are great. But I wouldn't tell you to not wear your seatbelt or not wear your airbag, because if you hit the tree, we'll have a hospital bed for you later. We know that that's not going to work as well as not hitting the tree in the first place. And so the same is true with COVID, and the same is true with all of these other ways that we talk about prevention. Let's avoid hitting the tree and focus on prevention. And while it's not fancy and it's hard to measure and it's not always pretty and it's a lot of work, that's where we make a difference. That's where we make a difference, not only in the health and well-being of each other, but also in the cost of care, which allows businesses to thrive more, and it allows our economy to thrive. The things are tied together, and it's not one or the other. So we have to continue to move towards patients and towards prevention as we move forward. I think there's a lot of noise in medicine, and there's a lot of noise in our world today. And I think that for me, meditating and breathing every morning is a way to settle that down. But I also think that thinking about what's most fundamentally important to our healthcare system is another way to get rid of noise. In residency, actually was my last shift in residency, an 18-year-old kid was stabbed in the chest, and he lost his heartbeat as well as ability to breathe and essentially died as he was coming into the emergency department. There's a procedure that you can do called a thoracotomy, where you open the chest and you see if there's anything that you could potentially turn around. It's a very high risk procedure. It's only something you do when someone's heart and lungs stop. It tends to work better on young people, and only when it happens right there in the emergency department or they just died. And so he was the right case for it, but everyone had actually left the hospital. It was right at shift change. So the attending surgeon had gone home, the attending anesthesiologist had gone home, and it was just us in the emergency department, and I was a senior resident. And we ended up opening up his chest and finding that he'd been stabbed in the heart, and there was a ton of blood around his heart that was collapsing his heart so it couldn't fill. We removed all of that, and I remember putting our finger, it was me and this other resident, in his heart, and opened up the blood, and it filled up his heart. And then suddenly his heart started to beat again. And then we were standing there with our finger in his heart beating. We checked his blood pressure, and he had a blood pressure, and he had a heartbeat. And fortunately, the CT surgeon walked down and said, "I see you guys have gotten yourself stuck." And we said, "Can you help us with the hole?" Anyway, he ended up living, discharged home a week later, completely neuro intact. But I remember after that, there was a lot of debate. A lot of people reviewed that case and said, "Why didn't you do this?" or "Why didn't you do that?" And an attending of mine said, "You know what, Anne, you have to always remember that you've got to do what's right for the patient, and remember the rest is noise." And those words ring clear in my head still today. And in my role as an emergency physician doc, in my role working in the hospital, and now my role as a state chief medical officer, I think about that case and those words all the time. Do what's right for the patient, and remember that the rest is noise. And I think as we're talking about COVID, we have to keep remembering that. What ways can we promote prevention, and what ways can we do for Alaskans? And remember that there's just a lot of noise, and ignore the noise and continue to find a way moving forward. We're entering a really challenging time with COVID. And I think one of the scariest moments of COVID for me was early on in hearing a friend of mine who was working in New York talking about the silence she heard in the emergency department and the ICU, where people couldn't breathe, and normally we're used to just this ruckus world of lots of things going on and just this still quietness when people couldn't breathe. And unfortunately, we're starting to see that here in the emergency department. I worked a shift last night, and it was a lot of I can't breathe. I can't breathe, I can't catch my breath, I can't feel this. And it's not just people with COVID, but it's also people after COVID who are still struggling. I feel like something's in my lungs, I can't get a breath. And it's eerily quiet when people can't breathe. Think that, as well as what we call the happy hypoxics of COVID, are the two things that kind of haunt me at night. And the happy hypoxics are people whose oxygen level drop, but they don't know it. And so they come in super sick and their oxygen level's down and it's low, and it kind of feels like talking to a ghost to me. I look at these numbers and I know that they're not compatible with the kidneys being well perfused and the brain being well perfused, but their oxygen level drops. And it's this kind of eerily weird thing about this disease and the way that it affects our lungs. that can make it so that your oxygen can be low and you can at the same time feel okay. And it has to do with how your body appears to, and how it responds to feeling like it needs more air and oxygen based on your oxygen versus your CO level. And so again, it reminds me of the breath and how important it is that we prevent so that people can breathe, so that we don't have happy hypoxics showing up and people saying that they can't breathe in the department. The other thing that I would say about COVID is that the word fatalism has come to take on a whole new meaning to me. It comes from the same word as fate and fatale in Latin, which means, you know, it's going to happen. It's divine and it's the way it's going to be. But fatalism has become literally fatal in our state and in our country. And this virus can only grow if we give it a chance to grow in an individual human. It needs our cells to replicate. And if we don't give it a chance to grow, it can't grow. And so we have to do what we can to slow the spread of this disease. This is not like an earthquake that happens to us. We have the choice on how we prevent this. And we have simple, cheap tools to do it. We stay distanced, we Zoom meet, we wear a mask if we have to be other people, we wash our hands. And I would love some fancy, sexy, cool little thing that if you just did this, it would all be gone. But in the reality, it's a series of mitigation steps. It's a series of things being worked together that prevents this virus from spreading from one person to another. So as we enter a really challenging time, let's not be fatalistic about this disease. Let's invest in our community and let's invest in our patients and each other and remember that the rest is noise. I'd encourage you all to take a look. We have a new winter resiliency campaign that hits many of the things that you guys have talked about in this meeting today, about the importance of staying physically active, mentally well, eating and taking care of yourself, as well as minimizing the impacts of COVID. We're entering a dark time, but just like we know the sun will come back, this too will end. And I think it's going to be a very similar path as the sun. I think by December and winter solstice, it's going to be a dark time in our state. But we don't notice much light on December 22nd compared to December 21st, yet we celebrate it because we know it's going to get better. We have vaccines on the horizon. We have more treatment options on the horizon. And I think just like the sun, by the time we get to summer, by spring equinox, we'll be noticing the difference. We'll be noticing how much better it's getting. And I think by summer solstice, we will be at a different place. I hope and I believe there will be things that will never change. I never again will work in the emergency department without a mask on. We know way too much about respiratory viruses now for me to ever put a patient at risk, even if it's a cold or influenza, and I will always wear a mask from here on out. And I hope that we're able to realize on the importance of prevention. We learned to tolerate influenza deaths. Last year, we had 11 people die of influenza, 3 children, 8 adults, the youngest was 23. But these are preventable diseases when we vaccinate, when we don't come to work when we're sick, when we hand wash, and while we do these things. We saw flu just plummet. RSV, which kills kids every year and is so damaging to little kids, they just can't breathe at all, plummeted. We were having a huge outbreak in the YK region. And as soon as COVID started and we started to wash hands and distance and wear masks, we saw RSV just plummet. And we ended up not having a really bad RSV season like we had. So we have tools to minimize these respiratory pathogens. We have tools to take care of each other, and we just need to use them because we're so much together. So with that, I'm just really honored to hear your stories and all the great work that you guys are doing. It's an honor to be here as well as this award. So thank you for the time.
Dr. Zink, thank you so much. Thank you for being such an inspiration during such a difficult time for all of us. And thank you for keeping us informed and safe during this pandemic. Thank you, thank you, thank you. I don't know how many times, I was telling March this earlier, I quote you during the week because we still get calls. It's not nothing, it's basically the virus isn't real, or it's like the flu, or why the mask and all that. And I don't know how many times I quote you a week because you are reputable and you get right to the point. It's about medicine, it's not politics. Thank you. Thank you so much. Really appreciate it. And on behalf of the American Lung Association of Alaska, I want to thank all of you for attending today to learn about clean air and the work of the association and to support lung health for all of us, for our community, our state, and our world. If you're invited to be by a bubble host who's arranged for a bubble hospitality room, please stand by and you will be notified on what to do next. Thank you all so much. We appreciate your attendance, and thank you so much for supporting the Lung Association and all of its wonderful life-saving work.